Welcome, everyone, and thank you for taking a moment to learn about our work. We are presenting on the topic of advancing health equity, addressing social determinants of health to improve outcomes for Black fathers experiencing paternal postpartum depression. We are an interdisciplinary research team committed to uplifting the Black community through the scientific study of Black fatherhood and Black families. Paternal postpartum depression affects about 1 in 10 fathers, yet it is far less recognized than maternal postpartum depression. For fathers, depression after the birth of a child often looks different. It may show up as irritability, anger, emotional distance, substance use, or working excessively. Because these behaviors are not always seen as signs of depression, many fathers are not identified, diagnosed, or offered support. Research on paternal postpartum depression has predominantly centered on white, middle class, heterosexual, married fathers, creating a critical gap in understanding the experiences of African American fathers, whose postpartum realities are shaped by distinct social, cultural, and structural factors.
To address this gap, we conducted a scoping review guided by the following research question. What are the experiences of paternal postpartum depression among African American fathers? We had 3 goals. The first, to identify gaps in the literature. The second, to clarify risk and protective factors. And third, to gain insights that can be used to guide future research and interventions that are responsive to the unique experiences of African American fathers. So on the right, you can see our review process. The initial database search yielded 2003 records. After removing duplicates and screening titles and abstracts, 61 full text articles were assessed for eligibility. In the end, only 2 studies met our inclusion criteria. Studies were included if they were peer-reviewed empirical research articles, published in English, conducted in the United States, and focused on paternal postpartum depression among African American fathers.
Study 1 included 59 first-time African American adolescent fathers aged 14 to 19. Their mean score on the Center for Epidemiology Studies Depression Scale was an 11.97, with scores of 16 or higher indicating depression. And our other included article, Study 2, included 296 low-income African American fathers and used the Edinburgh Postnatal Depression Scale, finding that 11% scored 9 or higher, the cutoff for probable depression.
The studies we reviewed also revealed important factors shaping fathers' postpartum mental health. Many of these factors are linked to social determinants of health. Structural risks, such as low socioeconomic status, racial discrimination, neighborhood disadvantage, and limited access to culturally responsive mental health care, create chronic stress that increases fathers' vulnerability to depression. Individual behaviors and supports interact with these structural pressures. For example, avoidant coping can worsen symptoms, while approach-oriented coping and social connectedness can buffer against stress. Because these risks are rooted in social and structural inequities, they are modifiable and can be addressed by dismantling barriers through equity-driven approaches.
Based on these findings, we recommend integrating father-focused mental health screenings into perinatal care to catch stress and depression early. Providers also need training in culturally and gender-responsive care so they can understand the unique pressures Black fathers face, reduce bias, and build trust. Finally, we must address the bigger social determinants of health. That means connecting fathers to community resources, advocating for policies that reduce economic and housing stress, and recognizing that mental health does not exist in a vacuum. Together, these strategies shift the focus from individual interventions to systemic solutions.
In conclusion, paternal postpartum depression among Black fathers is a real and often ignored public health issue. When we address systemic inequities and strengthen protective supports, we don't just improve outcomes for fathers, we support better developmental outcomes for children and healthier families.